I'm Kent, Emergency Preparedness and Response Program for the Chelan-Douglas Health District, but I'm actually also the Regional Emergency Response Coordinator for Region 7, which is Chelan-Douglas, Okanagan, Grant, Kittitas. So I try as best I can to be regional, but I do see myself more focused on Chelan-Douglas just because of COVID. So what is the Emergency Preparedness and Response Program? Basically, it's a systems approach for healthcare agencies to respond to public health emergencies. Okay, it could be anything from the pandemic to we have one of those smoke inversions that we often get due to wildfires, or anything else. If we had a huge outbreak of, legionnaires or something like that, we would help coordinate it. We're not the clinical people, that's Terry and her team, but we would support it through things like incident command structure. So our EPR staff, we work with the local emergency management group in both counties here, healthcare providers, other Region 7 local health districts, as I mentioned, and State Department of Health, and community organizations. So we can develop comprehensive response plans, and we can exercise those plans to make sure that they are written correctly and aren't missing anything. The staff is myself and Jennifer. So I came from the Chelan County Sheriff's Office. I did 34 years in law enforcement, 27 years with Chelan County. And my last 11 years, I was primarily a sergeant overseeing the emergency management division of Chelan County through the Sheriff's Office. So I have a fair amount of background in emergency management. A lot of that was just learning as I went, and responding to fires. We also coordinated all search and rescues, and we responded to flash floods and wind events and winter storm events. Had not ever been involved in anything health related really, other than kind of assisting now and then with the health district on smoke inversion stuff that we had to deal with. So my plan was to retire at the end of February and have a few months off and enjoy retirement. And then I talked to Luke, and I was well, between him and Kevin Overbeck, I was here within 3 weeks, I think, of my retirement, as a contracted incident command for the incident management team that we had for COVID. So didn't really get that retirement break I was looking for, but happy to be here, enjoying myself. And we continue in the incident management team, and that's going to continue honestly until we don't have FEMA funding to support it, and then that might be the time that we sunset on the IMT. Jennifer, she's been with the health districts for 10 years. She's been in the emergency preparedness response program for 6, and she is the program assistant for my position. She also, though, is about a third of her time is devoted to that WIC program that Carrie was speaking of earlier. So she's my primary assistant. Other staff that we have tied to emergency preparedness and response, but they also work with the other divisions within the health district. Our Margot Lopez, she's been here almost 2 years now, and she started kind of in like data and the contact tracing, all that, and now she's worked her way into being our CRIT team lead, which is basically our COVID response team that actually goes out and performs testing and performs vaccinations. She's also our logistics supervisor for the team. So as we need supplies like home, if we need home health test kits or we need anything related to COVID, she is the coordinator for accessing those resources. Anthony Stone came to us about 4 months ago. He's actually a firefighter with Douglas County Fire District 2. And he had capacity though, because of he primarily worked the weekend shifts at the fire district. So he had capacity to come to us as a full-time member and actually the CRIC team member as an EMT. So he is able to, through a health order, he is able to, as an EMT, provide vaccinations. He can do testing. His primary responsibilities are Toyota Center, are the testing that we do at Toyota Center. So he coordinates that. He also helps Danielle Turner go do vaccines at long-term care facilities and other mobile clinics, homebound, the jail, those type of things. So he gets out of the office. Margot assists with that as well. Margot's an MA, a medical assistant. I didn't put that on there. Ezekiel Castillo, if you ever knew Alma Castillo, who worked here for years and years and years, that's her son. He came, I think he was originally an outreach member, but then we hired him. He's like part-time permanent with us. He's going to school, so he doesn't have the capacity to be 40 hours a week. But we needed assistance with logistics. So he is helping with all the logistics with Margot, and he's also helping with facilities here within the health district as far as, just moving things around and stocking things. And we keep him pretty busy. We're always ordering large orders of test kits or things like that. So he helps with. So a very good kid, happy all the time. Ariana Mendoza is our most recent hire for this division. We brought her in when we saw a need that we needed some of the systems with data input into the WDRS system that Carrie was talking about earlier, where so if there's a positive test submitted or result submitted, then she's the one that is entering that into WDRS. She's working with the EPIs as well. She's been doing outreach with Kayla Brownlee, who is one of Veronica's staff. So we kind of have her wearing multiple hats. But she's learning as she goes. She came from Chelan County prosecutor's office as a clerk. So just on the program funding, the core funding for the emergency preparedness response is actually called the FEPR funds, which is the Public Health Emergency Preparedness and Response Funds, which is a pass-through. It's FEMA, not FEMA funds, it's CDC funds that pass through state DOH and then end up with us. As of right now for 2022, we received about $220,000 in that. So that's where if I code any of my time as just as EPR, that's coming out of those funds. Jen Torres also comes out of there, and we can use it for other things, as long as it's directly related to the emergency preparedness response program, we can tag it to that. We do receive some of the foundational public health services funds for the EPR program as well. In 2022 is about 168, well, so far 168,500, and that's kind of an estimate because we don't know how much we're going to need or use throughout the year. The FEMA MAP VAX funding is currently unlimited. That comes from FEMA to Department of Health, and then it's passed through to us to reimburse any costs directly related to vaccinations. It does not cover testing. It does not cover isolation and quarantine or anything else to do with COVID. 100% reimbursable, which having spent 11 years in emergency management, that was unheard of. To get 100% reimbursement from FEMA, you usually get 75% or maybe 87.5%, but you never saw 100% reimbursement. So that's actually very unique. I don't think a lot of people understand how that is. That is so good for local health jurisdictions to receive 100% funding. It can be a lot of work to do the reimbursement. So just ask Diane and her staff. It involves a lot of work. We also have the ELK funding, which is the epidemiology and lab capacity funding that is available as we need it. That will help cover testing, and that will help cover the cost of isolation and quarantine. So we have a local motel that we use for isolation quarantine. We've been using it since before I came here in March of last year, so probably pushing 2 years on that. Before that, it was a different hotel, but So we can bill that to the L funding. Any of the testing costs, like what we are running down at the Town Toyota Center, we're back to 5 days a week just because we're in a surge right now. So the cost of the site and everything that's related to it can be billed to that as needed. And then if we do run out of mass vax funds, we actually have $1 million of potential funding, COVID funding available to throw at mass vax. So this does expire, but they keep extending mass vax funding. It's in through September now, right? Yeah. So as that expires, we do have somewhere to go for funding. The total of our staff salaries of all the folks I mentioned is about $442,000. I'm not going to read all these to you. So that fee for funding has deliverables, and we're required to report on those deliverables twice a year, every 6 months. And so it's quite a lengthy process. You have to have evidence that you have actually accomplished these things. So if you updated a plan, you have to show that you updated a plan and have that ready for disclosure to the Department of Health. You have to, show you've done community preparedness or you've done emergency operations work with your county emergency management. Like right now, one of them, they do change though, they're not the same every year. Right now, one of them is the after action review, and we were kind of ahead of the card on that one. Luckily, we started our process on that way before this became a requirement for the fee for funding. So all of those are things that we have to give narrative on and have backup documentation just to prove that we're delivering what we say we're delivering for that funding. A little more on our incident management team. Veronica was referring to, she's the public information officer. I've been filling the incident command role since March 23rd of last year. I was contracted originally, and then I was hired in July. And so I became the regional emergency response coordinator and the incident commander when I was hired. So this is our current structure, our incident management team, which is the National Incident Management System. We're using it. It's used for hurricanes. It's used for wildfires. It's used for any type of all hazard emergency. And it first was used here when the previous, how many previous? Previous director was here. When Barry Kling was here, they started an IMT, but there wasn't a lot of training done with staff, and they were trying to do it in-house, and they had people leaving, and it wasn't working so well. So at one point, they started bringing in outside incident management teams. One was a Department of Corrections team, one was a Northwest Fire team, and the third one was the Pierce County has a team, and they came over. So that all happened in late 2020. And the nice thing about that is staff here were able to actually cross-train with those folks and shadow them and see, okay, this is what an actual logistics chief does. And this is what a planning chief should be worried about, and set priorities and what they were supposed to focus on. So now we are with this structure, which everybody on here, with the exception of we're working with Grant in Okanagan County sometimes, and then like Steve Lemensky is just a fiscal support person at DOH, but everybody else on here is a staff member of the Chelan-Douglas Health District. And we manage COVID. We brief twice a week in the mornings. And as things come up, it goes to the appropriate entity. So if we do need to order more testing supplies, it goes to logistics and Margo. If it's a financial issue, oh, that's not current. Cecilia has left us here recently, but it would go to Diane or Andy right now in finance. Or if it's operation specific, Stephanie has been filling that along with Ariana helping her. So, why do you use it? Well, because it needs that coordinated and structured response for any type of all hazard emergency. You have to have that coordination. You have to have this org chart. You have to know who answers to who. there just has to be a hierarchy and an understanding, and it's pretty simple to understand when you visualize it. So that's where we're at right now. The instant, whoa, darn it.
Click it again. You can right click here.
There you go. Thank you. What am I doing? Am I hitting the wrong button?
Yeah, the left one, yeah.
Okay, so what is National Incident Management Team, which is ICS? It's there to prevent, protect, mitigate, respond, recover from any kind of all hazards. So using the incident command system is how you do that. I'll talk a little more about training we recently had on that for our staff and other people in the region. It provides stakeholders in the whole community, which like shared vocabulary, common objectives that you use. Everybody works together as a team. Team is the theme of the NIMS program. Some of the community preparedness and collaboration that we do is we host a monthly Region 7 local health jurisdiction meeting with all of us. So we just had one at noon today with Grant, Okanagan, Kittitas, and ourselves. I routinely participated in the Chelan-Douglas Local Emergency Preparedness Committee meetings, the LEPC, which we'll talk about. It's kind of a hazmat focused group, but really it's there for all hazard emergencies to help coordinate and plan for any kind of emergency. So we take part in that. The COAD meetings, which is community organizations active in disaster, they had been hosting those up until they lost their local emergency coordinator. But that one's more of a resource meeting, and it's actually very helpful because you'll get everybody from the cities to the counties to Salvation Army may be there. Obviously, the Red Cross is there, and you can coordinate resources and know who can handle what in an emergency. So if you have a shelter that needs to be manned or multiple shelters that need to be manned during wildfire season, there are resources within that COAD resource manual that you can use, because locally Red Cross is having a hard time staffing everything by themselves. So you have those meetings so you can coordinate who else can actually participate. I have meetings once or twice a week with Chelan-Douglas County Emergency Management. That's pretty routine, but I have the nexus having come from them, so that's easy. I also host the LERC meetings, which is the local emergency response coordinators, which Kittitas, Grant, and Okanagan all have a LERC position, and we speak at least once a month, but probably much more than that by email. Sharing plans, anything that comes up, any resource needs, or just questions that come up, we can talk those through. One of the things we're planning to do is reestablish the Region 7 Healthcare Alliance. Used to be called the Region 7 Healthcare Coalition, which is healthcare providers, local emergency management, the health districts, all coming together and meeting every other month and doing trainings, doing presentations, looking at plans, those type of things. And we are participating in the Cascadia Rising planning, which is the earthquake planning. So the whole scenario of the 9 earthquake hitting the Seattle area, what does that have? How does that affect Central Washington and Central Washington? Meaning, we're probably going to see people brought over here for care, but we'll also see a lot of displaced people who don't have utilities and they need to go somewhere, and end up primarily they're going to be on the I-90 corridor if the scenario is how they say it is, because they're saying Highway 2 corridor to be shut down due to some of the old bridges. But I think eventually you would see a huge influx of people seeking services here, because we would still have them if the modeling is correct. So we've been participating in that. So these are our current projects. We have an after action review report for our response to COVID. Been working on that. Preparedness planning, emergency preparedness, community outreach, establishing a medical reserve corps, which we do not have currently. And then we provided the Instapan training. So just a couple slides on those. We started the after action review project back in the fall of 2021. We established a contract with Village Reach, which is a nonprofit organization that does primarily global health response, but because of COVID, they were locked down and they had time and staff to help. And I mean, honestly, Luke was the one who made that happen. He had the connections there. And so we've actually used Village Reach for several different things, but we have Katie Reynolds, who is a really good kid who's been working hard on this after action project. So we established surveys that have already gone out to current staff at CDHD, past staff. And currently we have the external partner surveys out there right now. And we're hoping it'll, be done and complete by the end of this month. And then we'll move into analyzing what the answers are. We allow people to provide narrative answers anonymously, so they aren't identifying themselves to us. And I think it'll be pretty revealing. We're asking people to think about 2020 versus 2021 to present on what the health district looked like, what the response to COVID looked like. Many questions in there. It's quite lengthy. It takes a while to complete the survey. Some of you either here or online may have actually received this survey. So by the fall of this year, we hope to actually have a complete published report by Katie and her staff to see what that looks like. We're looking for, what went right, what went wrong, what can we do better, how can we make it better based on the response to the survey. Preparedness planning is a huge part of my job. Our emergency operations plan here at the health district was last updated in 2018, but it needs even more updating, especially now that COVID hit and we had a pandemic and we're finding there were some gaps. The medical countermeasures and materials plan was one of them that was required in that fee for deliverable project that I was talking about earlier. So that was updated here recently and submitted. I sat down with Stan Smoke at Emergency Management and we updated the Chelan County Emergency Support Function 8, which is public health and emergency healthcare of the comprehensive plan for the county. We went through that page by page and updated that plan. We've got a draft avian flu response plan based on what was going on here, a month or two ago with, birds dying, and there were Okanagan County actually had documented cases of avian flu. Our Region 7 healthcare all hazard plan is still a viable plan, but it wasn't last updated in 17, so working through that. And then a wildfire smoke air quality plan, and it's also in progress right now. I have to have that out within the next couple of days in draft format for review. I mean, just to show, so I just pulled this slide out of the MCM plan, just showing, what might be in a plan. And this is a good visual in that we actually have points of distribution already set. So if you needed to, besides vaccine, but even masking, if you're going to distribute masks throughout the 2-county area, there are pre-designated points of distribution. All those red dots are there as confirmed areas where we can set up and distribute masks. We could distribute vaccinations. We could do testing. We could provide whatever is needed at these pre-designated points of distribution. Just some of our outreach. I'm not going to spend a lot of time on this, but I mean, we do other things other than COVID. So we do Firewise smoke education outreach. Jen Torres does most of these herself. We did some active shooter training right here in this room. Douglas County Sheriff's Office came and did a great presentation on active shooters for our staff here at the health district. Just general outreach, alert sense. We try to promote alert sense, which is used by the full Chelan-Douglas health district, emergency management to put out mass notifications to the public of emergencies. And then obviously we did a lot of COVID outreach, which was primarily Veronica's team doing that, but we were involved in a few of them. So, and then I, didn't put the worst possible picture of me. I really appreciate it. The Medical Reserve Corps, I haven't made any progress on that yet, other than I want to establish it. I've obtained the Kittitas County plan for how they set up their Medical Reserve Corps. They're the only ones in the region going into COVID that had an actual already stood up Medical Reserve Corps, which it's made up of retired RNs, MAs, and doctors. And that really helped their response having that. They were able to call on them and go to the fairgrounds and start doing vaccinations and testing and those type of things. And I mean, we did have non-MRC people that came and volunteered for us, quite a few of them actually. Some volunteered with Confluence, some just generally volunteered as a, independence. But it wasn't coordinated. It wasn't part of an MRC, and that's where we want to get, because you want to cover them liability wise, right? And you want to have a coordinated team effort of that group, all operating for the same objectives and the same goal and the same protocols. So that's what the Medical Reserve Corps would bring to us if we can get this started. I just need to find somebody who has the capacity to take this on, and I have a couple ideas on that. So that they'd be certified. We would recruit. We would obviously need to vet them and do background checks, establish the coordinator, train at regular meetings, and then keep them busy. I mean, when I was at the sheriff's office, I oversaw probably 40 volunteers in search and rescue. You don't keep people busy and interested through meetings, trainings, and actual response, they leave. They disappear because they want to stay busy once they join a volunteer organization. So we have to keep them active once we establish those. The Healthcare Alliance, this is just something that we want to reestablish. We had the coalition, which went away in 2018. They brought in Ready Healthcare, which covers all of Eastern Washington, where we used to have our own Region 7 healthcare here. And now it's all of this is Ready Healthcare. And that is not working well. It really isn't, because when you have your own local regional coalition or alliance to come together and go over plans and talk about response and what works and what doesn't work, and have presentations. That would have been really nice to have that in place when COVID broke out, but it was gone in 2018. Ready became immediately overwhelmed with COVID, and they're based out of Spokane, so they focused on this area. And we didn't see a lot of assistance through Ready. There was some, I'm not going to say none, because they did do coordination calls and briefings and put out a sit rep. But as far as what we really needed, I think if that Region 7 Healthcare Coalition had still been in place when COVID broke out, that would have been, a resource for this organization to turn to and have a better response. But that didn't happen. So anyway, we want to get back to that. That's something Luke and I have been talking about quite a bit. I think we have buy-off of the health officers and the other local health administrators to get this going. And we hope to have our first meeting in August. I think I'm still trying to fine tune which reoccurring day of the month that's going to be. But we'll talk about everything from trainings to exercises to, whatever's the top priority at the time. This is just a slide on notifications that are used. GETS is actually more of a resource for us. Everybody, all the administrators, associate administrators, myself, and Jen have GETS cards, which gives you a priority to make a phone call if things are tied up or not available elsewise. You can use a GETS card and make a phone call and get through in an emergency. But it has to be a documented, almost a FEMA type emergency before you can use that. WaSecures is a system that is used by Department of Health to call down new local health districts and staff to say that we have this emergency or we have this outbreak. Maybe there's there's a TV operating somewhere and they're concerned about it, they put out a law secures message to let all of us know what it is and what we need to do. CDC would pass through information to the law secure system as well. And then I already talked about Alert Sense, which we can use as needed for mass notification to the public if necessary through emergency management. And finally, we did the incident command system training. We hosted it, paid for it, sponsored it, along with the Wenatchee Valley College and Chelan County Emergency Management in June of this year. And it was well attended. We had slots for about 35 people. We had 27 folks from the region. And I think actually a couple came all the way over from the west side to attend this training. It's just all about that instant command system, how it works. It goes through everything. What are these positions for? What's the hierarchy? How, what's span of control? How many people can one person legitimately supervise without losing that control? All of that stuff. And it went very, very well. It was my understanding. I was on vacation, unfortunately, but I've had it before, and the feedback I've gotten is that it was well received, and we hope to have reoccurring ICS courses here that we host. So that's a lot of information, but I will take any questions from anybody.
Any questions? Yeah.
Perfect.